Do you like apples?
Yeah.
Well, I got a number. How do you like them apples?
Why apples? Can somebody tell me why he specifically chose apples for this insult? Hey, everybody, and welcome to the Cinema Psych Podcast, the podcast where psychology meets film. I am your host, Dr. Alex Swan, and in this episode, we're going to go back to a time when Matt Damon and Ben Affleck were just little bitty apples. That's right, we're going 1997's Good Will Hunting, written and acted in by Matt Damon and Ben Affleck. Matt Damon plays Will Hunting, the titular character, as it were, and Ben Affleck plays his BFF, Chucky. Gus Van Sant directed this movie, and there is a wonderful scene in another movie, Jay and Silent Bob Strike Back, where really good buddies, Kevin Smith and Matt Damon and Ben Affleck, because of the Miramax connection and Dogma and all these other kinds of interconnections that they've had. There's a great scene in Jay and Silent Bob Strike Back, which came out like 6 years after Good Will Hunting. And they had this gag where Matt Damon and Ben Affleck were playing versions of themselves, and Gus Van Sant returns to direct, but he's so enamored with all of the money he made with Good Will Hunting and all of the money he's going to be making with Good Will Hunting 2. And Ben Affleck is there, and they got the same guy who gets told off in the bar, Scott William Winters. Fun fact, Dean Winters is brother, I believe. Yeah. And Brad Winters. Anyways, Scott William Winters returns as the same character from Good Will Hunting, Clark, and they just make a wisecrack joke after wisecrack joke, and it weird digression. Yeah, I know, but that's the thing that I remember about Good Will Hunting, is that they did a spoof sequel in Jay and Silent Bob Strike Back, because I saw the latter movie when I was, a adolescent, so it was easier to remember. And then, of course, around that time, you got your hands on a DVD, and you just kept watching the same thing over and over, laughing at the stupid, dumb jokes, some of which do not hold up, of course, only 21 years later. It's the thing that I remember, so that's what connects me to Good Will Hunting. I saw Good Will Hunting when, I was a preteen, so or even younger than a preteen. So yeah, I was about 11, I guess, when I saw Good Will Hunting. Yes, I did watch it when it first came out. My parents somehow did let me watch it as an 11, 12-year-old. Interesting, right? Yeah, I have very vivid memories of watching this movie, not for a 12-year-old to be watching, 11 or 12-year-old, however old I was at the time. Yeah, with all of the swear. Hey, it won an Oscar. What are Matt and Ben won for best screenplay. So what are you gonna do? But that's my connection with the movie. But on this rewatch, I've seen it a couple of times between the first time I saw it when I was a young boy and for this episode, I had seen it a few times, And it didn't really resonate with me until I watched it this time for the rewatch. And I gotta say, it's a really good movie, right? You've got also, I obviously can't forget the amazing Robin Williams, like super deep in this intro, and I've barely even mentioned like the best part of this movie. And then, of course, Casey Affleck plays a bit role, obviously that friend, brother, co-star. Cole Hauser, Stellan Skarsgård, plays an interesting academic fellow, lauded math professor at MIT. And Minnie Driver plays Skylar, the love interest, which we'll probably get into in this episode. There's a lot of psychology in and around their relationship. And then, of course, just the idea of Will going to therapy. Just a brief synopsis. There's not much to give away in this movie other than it's a feel-good story. Will Hunting is a South Boston current resident, and he's doesn't think that people will value his intellectual abilities, and so he hides it by being a tough guy. He doesn't open up to anyone. He constantly jokes and belittles and just that sort of toxic masculinity way. I will venture out to say they really rub that one on, right? And so he gets in trouble for a fight, goes to jail, and he's a janitor at MIT and solves a proof on an open board, and they're like, who is this guy? So Stellan Skarsgård's character Jerry needs to go in and get him to be an amazing mathematician and publish with him and all that stuff. And there's a little bit of self-serving in there, of course. We can get into that. And then along comes Robin Williams as part of his court-ordered release with Jerry, the MIT professor. Robin Williams is a professor at a community college, and he tries to talk Will into opening up and allowing himself to be vulnerable and do what he wants and not be stuck in his past and his relationships. So we're going to get into all of that. It's a really solid movie. I give it 2 thumbs up. I'm excited to jump into this in this episode, so let's do it. My guest host today is Dr. Ed Hansen. Ed joined us last year to discuss Thank You for Smoking in episode 58. Go check that out if you didn't catch it. Ed is a specialized teaching faculty member at Florida State University's psychology department, where he teaches a variety of courses, including IO, research methods, psych of personality, and social psych. Ed, welcome back to the show.
Hey, thanks very much, Alex. It's really, really nice to be back. It's hard to believe that even though we have still yet to meet in person, this is my 3rd time on your show. So I do feel like we go way back a little bit.
Yeah, we kind of do, because it's not just talking on this medium, but other mediums as well. Yeah. So are you going to be at ACT in October 24?
No, I think I'm going to I'm going to check out the regional teaching conference this year. I'm going to check out the Southeastern Teaching of Psychology Conference, CTOP, in Atlanta, which is not a bad drive from Tallahassee. Normally I do the NITOP conference as it's a little friendlier to stay in Florida, but I wanted to support the CTOP folks as well. So I'm going to check that out. And ACT continues to be on my list. Maybe someday.
All right. So maybe next time when it's farther south than Louisville, Kentucky, right? I feel like it's been in northern places recently, and it's in October. I don't know about that one anymore, Gets a little chilly.
I mean, I understand they want to sort of cover the areas that are not Florida in many ways, since NITOP is always in Florida, making it available for people that aren't going to go for one reason or another to Florida. I get that.
Yeah, Florida. Oh, goodness. We're not going to get into that one right
here. Keep it at one reason or another.
Right. Okay. Well, it's really fun to have you back on, as we've already established here. So, barring the let's meet up at a conference some point. What were you up to this summer? I heard you went on a little trip.
Yeah, yeah, and in fairness, it was not a little trip. It was I had the opportunity to teach at Florida State's London Study Center in June.
Wow.
This is
Okay.
actually the second time that I've participated in this program. But in addition to like the broad field classes that they offer on a wide range of topics of like theater and history and everything else, the psychology department has this nice tradition with the London Study Center when we send over about 40 students and 2 professors. And the first month, they'll take a class with one professor. That was me. The second month, they take it with a second professor. And so, like I said, I went in 2018 and hadn't been back since. COVID, kids, all those kinds of things.
Yeah.
But it was amazing to be back. And real quickly, I taught like a cross-cultural applications of social psychology class. And we really lean into identity and identity development, which is not irrelevant to today's topic, which we'll get to.
Sure,
but,
yeah.
It was during the Euro Cup.
Oh, that's right. That's right.
We call it soccer. They call it football, but it was in the Euro Cup football tournament. The last time I was there in 2018, England made it to the semifinals of the World Cup. So I'm like a good luck charm to almost get it. They made it to the semis and lost. They made it to the finals and lost.
Right.
But I was just glad my students had a chance to like bask in the reflective glory. It's so funny because by the end of a month, they're like, I think we can do it. I think we can win. And it's like, you're American. And so it's really fun to see that happen.
I think we can win. I love it.
Yeah. And then as soon as they lose, I guess they just didn't have it. They cut off that reflective failure just as quickly. And
I'm so happy for them that they got to experience.
Sport was just one element of what we were looking at. We also happened to be there at a time when they were having a national election. The prime minister was elected on the day I left, actually. So we did a tour where we learned about the history of England and Europe and Brexit and all of the many, many multiplicative factors that contribute to something like that. Some of my students had never heard the word Brexit before, but they really came out with a new appreciation, which was great. We did a food tour that emphasized immigration and the influence of change over time in British cuisine. We saw a play. It's a great experience. I didn't have the opportunity to study abroad as a student, but being able to do it as a professor is pretty fulfilling and rewarding.
That's awesome.
And the kids came, and Megan and the kids came for the second 2 weeks of the month. So I sort of got my feet wet. I got things going with almost unsettling amount of freedom for 2 weeks. And then they came the second 2 weeks. And then we also saw some family in Ireland and things. It was really, really good. Much different than we were pregnant with our first son. And then this time it was full circle to take him back to where we found that out and things. It was really cool.
That's awesome. That sounds real fun. I can't wait to do that sort of thing myself. I've got either London in 2 years or a Germany trip in 28 that I am that I get to plan. So that one's going to be fun. History of Psych in Germany. Ooh, boy, it's going to be great. All right. So speaking of prestigious towns in the world, London, of course, I'm talking about. No. Let's go across the Atlantic to that shining New England's lighthouse, I guess. I don't know. Boston. We're going to Boston, right? Boston. I'm going to try to refrain from using my terrible Boston accent in this episode. But we're going to Boston to go to a prestigious university, MIT, Good Will Hunting. So before we jump into the psych of it, what was on your radar for Good Will Hunting for the pod? Why the suggestion?
Yeah, you and I were going back and forth a little bit on what movie we should do for this episode.
Yeah.
And we certainly had no shortage of ideas. And then I made a reference. Sometimes I think you can understand this when you make an obscure reference to a movie and someone doesn't get it. And it's like, oh, I want them to get that reference. And I made a reference to Good Will Hunting and you didn't get it. And I was like, oh, when are you going to do that pod? And it just sort of happened.
Interesting. Okay. Because it has completely flown over my head now. And obviously several weeks in the past.
But Alex,
what was the reference?
It's not your fault.
Oh, okay. All right.
It's not your fault, Alex.
Okay.
It's not your fault.
Thank you. I'm not going to start sobbing
No, this doesn't have to be our big trope breakthrough, but it's still what was inspiring. No, I've actually just always loved this movie, and I recommended it to you because there's so much psychology in this movie, and you teach with psychology. At least it just seems like one that should be on the docket, even if therapy is not either of our backgrounds.
No, yeah, that's going to be the disclaimer. Like I try to disclaim in all of the clinical psych episodes that not licensed therapists, but we have an affinity for, and we do teach a little bit of these ideas, at least in some sort of intro kind of class. I know I do for mine. I go through the different kinds of therapy and I explain it to them all, and then I even touch on hypnosis in history of psych. It's not really mentioned in any other class, and I'm just like, they need to know about hypnosis.
They have to know what it is and what it isn't.
Right. And so let's jump in, because we're not therapists, but we have an affinity for the kinds of portrayals that are offered in Hollywood films. And this one is, for some of its little missteps or expediency for expediency's sake, it is a pretty good exploration of what a patient-client, specifically the word client here, interaction might be in a specifically cognitive behavioral setup, right?
Definitely. I think that there are so many stereotypes of what therapy is, of what therapy looks like and things. And I think that this movie doesn't lean into too many of those. I think that when we get to Robin Williams' character, I think that he reflects, not all the time, but a lot of what good therapy can be, or what it can be at least related to.
Yeah. So let's define and discuss the broad therapeutic method that is being offered in this movie, and we'll define that, and then we'll contrast that with the other two therapists that we see on screen. So, Ed, take us through your understanding of cognitive behavioral therapy, and then I'll jump in after and
sure. I think cognitive behavioral therapy. Why cognitive behavioral therapy is so common, is so popular, is so widely used, is that it's a little bit eclectic in nature. That you are not just trying to target one thing. That you say, okay, you've got these feelings that are upsetting, but what do you do with them? How do you feel about them? What do you think about them? Mm-hmm. And I always use that triangle model of like the thinking, the feeling, the doing. Mm-hmm. And I think that cognitive behavioral therapy is to try and guide clients in understanding how their actions are related to their thoughts and feelings, and vice versa. And so that's a good starting point, I think.
That is a good starting point. I'll add that some of the ideals that CBT embodies as a broad therapeutic message. Of course, you can like dive into deeper specific CBTs, but I wanted to add the work of Carl Rogers that he did in the 1950s and 1960s, and sort of trying to wrestle, let's say, the grip of psychoanalysis and psychodynamic theory in like APA, the American Psychological Association, and the clinical periphery. The radical idea that sometimes people just want to talk, and when they talk, they'll reveal things. And when will they reveal things? Well, when they have trust in who they're talking to, right? And the trust starts with this idea of unconditional positive regard, right? So in the movie, we have Will, who is struggling with lots and lots of trauma, and Sean, Robin Williams' character, is trying to help him using these kinds of techniques.
What do you see? Something's in my room. What is it? It's like it's a figure. It's hovering over me.
You are in a safe place, Will.
It's touching.
Where is it touching you?
It's touching me down there. I'm nervous.
You don't have to be nervous, Will.
We start dancing. The dancing is beautiful. 'Cause we can make a lot of love before the sun goes down.
Sky rockets in flight, afternoon delight. Hey, afternoon delight. Sky rockets in flight. Da 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 da.
I'm sorry, Rick. I have better things to do with my time.
Hey, afternoon delight. Come on, one dance. You really hypnotized me, you know.
For God's sake, Will.
What? Oh, come on. He left. You can't pin that on me.
I told you to cooperate with these people.
Look into my eyes.
Get out, Will.
I don't need therapy.
That's enough. Get out.
Before we jump into what Sean does, because I kind of want to save that to like the accurate portrayal. What are the other two therapists we see on screen, Ed, and what are their qualities?
Sure. So the first one appears to have made a great name for himself writing books. That Will read his book before going into this session. And it kind of seemed like, the pop psych books, that it's about these big discoveries. It's The Secret, those kinds of things. And you get the sense he hasn't actually worked with patients with difficulties in quite some time.
Yeah. Yeah, because he is an older guy as well.
Yeah, he's an older guy. But not only that, there's this line where he says, okay, I think that you just need to stop it. It reminded me of there's a Mad TV sketch.
Yes, I just saw that. I am so happy that you mentioned this because tragically Bob Newhart died, but that's the sketch you're talking about. And I am so excited that you just mentioned that because I only watched it a few days ago.
It's a reference we can share now.
Yeah.
And so when people like Bob Newhart pass away, and previous listeners of my episodes might know that I especially really like comedy, and he is a comedy icon, not just for his television shows, but his stand-up. Yep. But he's always got this super dry delivery. And when he's meeting with the patient and tells her to just stop it, that's basically what this guy is doing. Yes. He's not even getting into like unconscious desires. He's not getting into any of the Freudian tropes. He's just saying, cut it out. You just got to cut it out, son. No more shenanigans. No more tomfoolery. No more ballyhoo.
Yes. I'm laughing a lot because I did my rewatch before I watched that sketch. Yeah. And I wish I had done the opposite order because it's been a while since I've seen the Stop It sketch. It's probably been a good couple of decades. So I didn't remember. And watching it in order would have been hilarious. I will say he did strike me as a neo-Freudian just by like the stereotypical dress. But granted, he wasn't smoking a pipe or asking the patient to look away and not face as to not get unconsciously biased or all that.
Which could still be under the umbrella of neo-Freudianism, right? Yeah. I mean, that taking the bits and pieces of Freud that you resonated with is something so many of those clinicians did for so long. But yeah, he really just, when he comes out, and I don't know what he called him, a loony or something, I was like, this guy's not talking like a therapist. I do not understand why he just thought a 30-minute session with this guy, he was going to fix him. But he seemed very disconnected from doing the work.
Bob Newhart only charged $1 per minute for up to 5 minutes. And he tries to get this woman out in 2. He's like, that'll be $2. Looks at his watch. Anyways, enough of that sketch. You bring up a good point that And then that's really what got me. As soon as I remembered this, I kind of forgot about these other two therapists. But as soon as he was like, "Hey, he's a loony," and it's all in response to Will trying to out him as gay, because at the time in the late 90s, especially written by people like Matt Damon and Ben Affleck from this area, it was probably one of the jokes that don't hold up because of how homophobic it was.
Even if it's not trying to hold up, because I agree with you, I think that it would resonate with the homophobia you would actually see in the Boston, South Boston area of that time. I always use moments like this to sort of share, and we'll get into self-disclosure later, but self-disclosure as a professor, self-disclosure as a counselor, there's always a fine line of how much is too much to share.
Right.
And when I'm teaching about implicit bias, I talk about when I was in high school, it was really common to hear that phrase, "you're so gay," thrown around and not questioned.
Right.
Not to say like, oh, the person who said it is obviously doing something wrong. It was just something we never questioned.
Right.
Then I get to college and I start questioning it for the first time, realizing it might actually hurt people, thinking about my own implicit bias and how I don't want to have that bias, how I can remove that phrase from my dialogue. If I hear someone, can I say something about it?
Yeah.
But yeah, watching that in 1997, I don't think I would have blinked. Watching it now is a much different experience.
Yeah, and it kind of hit different too, not only with the back and forth between the two, the dialogue, but just like the posture shifts of the therapist and it somehow being true, right? And you get this kind of not only the words that are hurtful, but like even just the intent of what the character is doing, right? Get under his skin in the worst way possible.
And that's what he sets out to do with Sean. That's what he sets out to do with the hip. Whenever he can.
Yeah.
So you get these over with as quickly as possible. And most of the time he's effective in the movie.
Right. So you mentioned the hypnotist. He's the second one. Talk a little bit about this guy.
Yeah. I mean, the idea that someone as resistant as Will Hunting is going to get hypnotized by this person is laughable, right? Because
even before they started
hypnosis, I've been hypnotized a couple times. I don't know about you. I've been hypnotized like in those on stage shows a couple times, and I actually get a big kick out of it. And it's kind of fun to just let go in those moments. It's this increased state of suggestibility, and you have to be open to the suggestions that are being made, whether it's for entertainment purposes, which I have done, or therapeutic purposes, which I have not. And so the idea of like, oh, sure, I'm going to be this operatic tenor and sing happy birthday. You're open to that suggestion under a state of hypnosis. But one of the big myths, and so many people teach intro psych, especially as like myth busting, is you're not going to hypnotize someone to do something against their will.
Right.
In Office Space, the first movie we ever did together, you're never going to hypnotize someone where it accidentally just becomes permanent.
You're right.
When the hypnosis dies. And so you're not going to have these, it's not magic, right?
Right.
The person has to allow themselves to be open to hypnosis. And Will is just the opposite of open. He is a locked door. He is not going to let anyone in. So it's not surprising at all, even though you can tell the hypnotist is really hurt when he starts making fun of him. But it's just not the right approach for Will Hunting at this point.
I think the hypnotist may have set himself up for failure, of course. And so like he walked into that. Yeah, Will shouldn't have been an ass, making fun of him by pretending to be hypnotized.
It's like Will has been court ordered for therapy.
Yeah.
These are not going to be the therapy clients that are trying to improve themselves. These are going to be the people who are going to be jerks. These are the people who are going to push back every chance they get. And this is not like, Hollywood taking a lot of liberties. I think that's one of the more realistic parts of the whole film, is that a person in his position who thinks it's a total waste of time is going to treat it as such.
Yeah.
He's not there to grow. He's there to just say like, I know more than you, and this isn't going to help me.
Right. I did also clock that he was of some South Asian descent, had a bit of an accent. So I feel like this again was Matt and Ben having a little bit of a we'll say cloudy mindset when it comes to other ethnicities.
Yeah, that's fair. I hadn't looked at it that way, but I think that, like, especially, again, this is a movie from the late 90s. Not everything is going to be evergreen. And it can be a cheap joke to sort of put in, like, Asian stereotypes. To me, I didn't hear or see the stereotype, but that doesn't mean it's not there. So I think that you're probably onto something.
The thing that I think puts it into perspective when we get to Sean versus the other two is Sean kind of just goes maybe the level of effort that you would find at a cocktail party with people that you don't know. Like, he goes, hey, how you doing? Do you like, what do you like? What do you do? These kinds of basic questions that we would ask strangers, right? And so when he finally decides to treat Will, what things did you notice about his therapeutic approach?
Well, actually, so even though you say he's staying really surface level at the beginning, my interpretation of that was that he could see Will had up these defenses.
Mm-hmm,
he says, true. Okay, we're not gonna have a breakthrough in our first 1 hour session.
Mm-hmm.
Right. I actually listened to a couple interviews with an actual therapist and their thoughts on the film just to get a sense for it.
Mm-hmm.
And one of the terms that they used that I thought was really helpful in understanding his approach was called rolling with resistance.
Okay.
And so he's pushing back and all these things. So let's say Will says, have you read all these books in your office?
Mm-hmm.
And then Sean replies, do you like books? Right. And so he's not, I think on the surface, do you like books is a surface level question.
Yeah.
But he's putting it back to him and saying, oh, you want to talk about books? Let's talk about what you want to talk about.
Yeah. Right.
And so I thought that was actually a nice way for Will to not just shut down and clam up, which we see he is totally capable of doing later when he doesn't want to talk at all. But I think Robin is just trying to get him, to where he'll talk, to where they can talk about something. And it doesn't have to be this massive breakthrough. And Sean's going to tell Jerry what they talked about afterwards. And Jerry's going to be frustrated. Why didn't you talk about things that are useful? And he says, because we're just talking. We're just building rapport.
Yeah.
And so to me, and especially with Sean's first lecture about building trust I think that he was just trying to keep the door open. Now, of course, as soon as his wife comes up, that door is slammed shut pretty firmly.
I want to jump in here and say that I think this is the first time this has ever been uttered, so trademarking this. That was Chekhov's lecture.
Wait, so his lecture in the classroom?
Yeah, Chekhov's lecture. Just like Chekhov's gun.
Ah.
It's the thing that gets shown at the beginning of the movie and it comes back later.
I see. Yeah, I think that makes sense. I think that it's a nice piece of foreshadowing that we're going to need.
Yes. And Chekhov's lecture, though, it sounds better than foreshadowing. I'm sorry. It just does, right? And I now it can go on to knowyourmovietrope.com or whatever and add Chekhov's.
I've got another
Chekhov's
one
lecture
now.
Yep, you gotta remember. Oh, I've seen that before. It's the Matt Damon, or not the Leo DiCaprio meme. I've seen that one before. There it is. That is a Chekhov's lecture.
Very good.
So you mentioned this, and that was an interesting digression. You mentioned this building of rapport, and that it is tied to this unconditional positive regard, always presenting to the client a positive affect, regardless of what they're doing or saying or have done, to validate them as a human being. Like, you are a person.
Even though, of course, we alluded to it, as soon as he brings up his wife and he chokes him, right?
Yeah.
Elephant in the room. He chokes him. In a real therapeutic relationship, the trust is not going to be gained so quickly.
No.
Okay?
I would hazard to say this is not the portrayal. You want to just cut around this bit if you're showing techniques in fictional Hollywood films, because Will could have totally pressed charges.
Oh, absolutely. That was an assault. And the therapist I listened to said that they would love to see the notes from that session.
I love it. Yeah, right? Be a fly on the wall, too, after that. Oh, boy. How did he smooth that one over? So they eventually
didn't give up on him. He said, I'll see him on Thursday at 4:00. Make sure the kid is there.
Yeah, exactly. There's another strategy, just basic therapeutic strategy, before we even get into what he offers, that I'd like to add myself based on my own experience. So when I was in grad school, I had a therapist, and she was a cognitive behavioral therapist. And one of the things that I learned in the process of, going to sessions with her, as well as, just being a grad student, and so having a ton of time to read and learn about things, I read a lot more about cognitive behavioral therapy and the history of psychology, and it's been really helpful teaching history of psych when it comes to the 20th century and the clinical shift. But when I would go to her sessions, I would always have to be the one to talk first, because in client-centered therapy, per Rogers, and this is a broad generalization, so there might be some nuance here that a lack of training in this area would afford. So he has a session the next time at 4. Make sure the kid is there. He has a session. Sean has a session with Will, and they don't talk for an hour, and that's because Will refuses to talk. Selective talker, because he kind of does love to talk. And this is exactly what my therapist would do. I had to talk first, and we would stare at each other awkwardly until I had the right words to say, and we would go from there. There generally wouldn't be any silent periods after that initial over the hump. And the follow-up scene where Jerry runs into Sean, what did you guys talk about? And he's nothing, and they have a back and forth about the whole the lack of conversation, I'll say. And Sean says back to him, I can't talk until he does, kind of thing. And I thought that was really cool, because it showed me from a filmmaking perspective that either Matt or Ben or both either had experience with this kind of therapy in the past, or did their research and chatted with professionals to find out how to make it more realistic. And that I really appreciate from the characterization of Sean.
Yeah, because obviously it's not just a staring contest between two guys from Southie, right?
Yeah.
It's, like Sean jokes that it is, but I think that that's him just sort of telling Jerry, this isn't your problem. You focus on the math. I'll focus on how to do therapy. But yeah, that's what it is. I've got to let him talk first. And I think that it was just sort of him diffusing it in a way that Jerry wasn't going to talk to him about it more. Because, goodness, at the beginning, Jerry and his research assistant, Tom, or whatever, they're in the session with him. And Sean's like, okay, see you later. You too. Bye now. And Jerry was almost aghast that he was being asked to leave. And I was like, no, this is the relationship between the client and the therapist. And what happens in there, I'm giving you the reports, but you are not privy to how I do what I'm going to do here. And so I think that that was a really good representation. Now, interestingly, I don't think Sean is always good at that, the character of letting Will do the talking. Like, I think that there's even the line Will says, you talk a lot for a therapist, where he's talking at him and kind of like the scene on the park bench, for example, is outside the realm of CB. It's just really good cinema is what it is.
Yeah.
Is that I love that scene, but I don't think that that's the representation of therapy.
So what's this? A taster's choice moment between guys?
This is really nice. You got a thing for swans? Is this like a fetish? It's something like maybe we need to devote some time to?
Thought about what you said to me the other day about my painting. Stayed up half the night thinking about it. Something occurred to me. I fell into a deep, peaceful sleep and haven't thought about you since. You know what occurred to me?
No.
You're just a kid. You don't have the faintest idea what you're talking about.
Why, thank you.
It's all right. You've never been out of Boston.
Nope.
So if I asked you about art, you'd probably give me the skinny on every art book ever written. Michelangelo. I know a lot about him. Life's work, political aspirations, him and the Pope, sexual orientation, the whole works, right? I bet you can't tell me what it smells like in the Sistine Chapel. You've never actually stood there and looked up at that beautiful ceiling. Seen that. If I ask you about women, you'd probably give me a syllabus of your personal favorites. You may have even been laid a few times. But you can't tell me what it feels like to wake up next to a woman and feel truly happy. You're a tough kid. I ask you about war, you'd probably throw Shakespeare at me, right? Once more into the breach, dear friends. But you've never been near one. You've never held your best friend's head in your lap and watch him gasp his last breath looking to you for help. I ask you about love, you'd probably quote me a sonnet. But you've never looked at a woman and been totally vulnerable. Known someone that could level you with her eyes. Feeling like God put an angel on earth just for you. Who could rescue you from the depths of hell. And you wouldn't know what it's like to be her angel. To have that love for her be there forever. Through anything. Through cancer. And you would know about sleeping sitting up in a hospital room for 2 months, holding her hand, because the doctors could see in your eyes that the terms visiting hours don't apply to you. You don't know about real loss, because that only occurs when you love something more than you love yourself. I doubt you've ever dared to love anybody that much. I look at you, I don't see an intelligent, confident man. I see a cocky, scared, kid. But you're a genius, Will. No one denies that. No one could possibly understand the depths of you. But you presume to know everything about me because you saw a painting of mine. You ripped my life apart. You're an orphan, right? Do you think I'd know the first thing about how hard your life has been? How you feel, who you are, because I read Oliver Twist? Does that encapsulate you? Personally, I don't give a shit about all that, because you know what? I can't learn anything from you. I can't read in some f***ing book. Unless you want to talk about you, who you are. Then I'm fascinated. I'm in. But you don't want to do that, do you, sport? You're terrified of what you might say. Your move, Chief.
Yeah, I mean, I've never heard of people going on field trips. I think that opens privacy concerns.
To be fair, I did have a roommate in graduate school that specialized with OCD, and they would do field trips. They would do exposures in parks. They would do exposures at gas stations, places where they could potentially see germs and things like that. So, but yeah, that part you have to sort of suspend disbelief there a little bit. But
yeah, I think it was a filmmaking
to leave out. Yeah,
it was a filmmaking choice because you'll recognize that this Gus Van Sant did not pull away from Robin as he gave this monologue on the park bench. The shot is Robin Williams. There's a point, and so dialogue usually, even if it's someone monologuing for a little while, if they're right next to each other, there will be cuts to the other person for their facial expressions, but none of it. It was a 100%. This is a Robin Williams scene right here. This is a Robin Williams scene stealer right here.
Yeah.
Because he's just quick with it. I will also point out that there is where he sort of strays from this ideal of what they present on screen, which is, kid talks first. A following session, most of the session that we see in the movie, of course we don't watch the whole hour in real time, is Robin Williams, Sean recounting how he met his wife. And it's like, wow, okay. So you're now just monologue. And I know they were actually, it was a dialogue, but Sean talks a lot. And I don't think that would
I think that gets into what I was saying earlier about self-disclosure. I think his boundaries are probably too loose. Like Will even is like, you're my friend at one point in the film. And a real counselor would say, like, I'm your counselor, you're my client. You can't be friends.
We're not friends.
That's like by definition, you can't be friends. But, deciding how much to self-disclose in a classroom or in a session, I'm sure is a balance, right? And different people are going to strike a different balance.
Yeah.
And I know that I have slipped into the trap of sharing something that afterwards I was like, oh, that really wasn't relevant for the topic or as relevant as I hoped it would be.
Yeah.
You have to make sure it's about what you're trying to accomplish, not about you.
Yeah.
And it did show him, though, I think it was getting through to Will. So he was like, this guy's not going to open up to me unless I share with him a little bit and share some personal things. And so I don't think that that's the only way you can reach a client by any stretch. But he read the situation as like, okay, I'm going to share this. So the amount of self-disclosure is high, but it's probably not entirely unrealistic. There are probably some counselors who will share pretty personal stuff in order to connect with a client.
So there's one more inaccuracy before we jump into the actual therapy bit to end this segment. So there's one more inaccuracy that I spotted, which was, man, oh man, he gets healed pretty quick.
Yeah.
So that's just a therapy thing as a whole, not CBT related.
It was the all at once breakthrough.
Yeah, all at once breakthrough. Had a good sob over it, and hey, we're done. Hooray! No more court mandated sessions, which means I'm peacing out. My name is Sean. I'm gonna go experience the world, and my name's Will. I gotta go see about a girl. So yeah, no, therapy in general isn't going to be this quick. It's not going to be 10 court ordered 1 hour therapy sessions. It's just not going to happen. Where 10 of them may also have included the other people that he saw, right? So maybe he didn't have to restart the clock every time he went to a new one. But in any case, yeah, therapy doesn't go that quick, especially with the amount of trauma that Will is carrying with him. So I just got to say, don't Don't think that when you watch this movie that's going to be your experience in therapy. It's
no, but again, I think the director, he just that "it's not your fault" scene is so beautiful.
It is. It was wonderfully acted. I have no bones about it.
It's worth it for a slight inaccuracy.
Yes,
to bring that
from absolutely inaccuracy as far as therapy in general and outcomes, but damn good cinema.
Yeah, they're not going to win the Oscar for screenwriting with real therapy sessions.
That's true. They aren't, and it's likely the two of them won the screenplay Oscar because of that scene.
Very, very possibly.
What is that?
This is your file. I have to send it back to the judge for evaluation.
Oh. Hey, you're not gonna fail me, are you? What's it say?
Want to read?
Why? Have you had any experience with that?
20 years of counseling. Yeah, I've seen some pretty awful.
I mean, have you had any experience with that?
Personally?
Yeah.
Yeah, I have.
Sure ain't good.
My father was an alcoholic. Mean and drunk. He'd come home hammered, looking to wail on somebody. So I'd provoke him so he wouldn't go after my mother and little brother. Interesting nights were when he wore his rings.
Yeah, he used to just put a wrench, a stick, and a belt on the table and just say choose.
Well, I gotta go with the belt there, Vanna.
I used to go with the wrench.
Why the wrench?
Because him, that's why.
Your foster father.
Yeah. So, what is it, like Will has an attachment disorder? Is it all that stuff? Fear of abandonment? Is that why I broke up with Skylar?
I didn't know you had.
Yeah, I did.
You want to talk about it?
No.
Hey, Will. I don't know a lot. You see this? Holy This is not your fault.
Yeah, I know that.
Look at me, son. It's not your fault.
I know.
It's not your fault.
I know.
No, you don't. It's not your fault.
I know.
It's not your fault.
All right.
It's not your fault. It's not your fault.
Fuck with me.
It's not your fault.
Don't with me, all right? Don't with me, Sean, not you.
It's not your fault. It's not your fault.
Oh my God. Oh my God, I'm so
Fuck them, okay?
Let's jump in to end this segment on the actual therapy that is portrayed in the film. And what I mean by that is, so cognitive behavioral therapy is a set of principles, as you described earlier. And these sets of principles allow therapists to, as my therapist said, create tools for their toolbox, not only to help them with their thoughts, cognitive, and their behaviors, behavioral part of CBT. And then you did mention the triangle bit, because there are other factors in a good biopsychosocial model. It's not just thinking and behaviors, but thinking stems from your biology, right? So we've got that whole piece coming together, and we kind of see these processes occur in the movie. So what are some of the therapeutic principles of CBT that you saw in this film, Ed?
Well, I mean, when you're talking about like what kind of behavior can you change, maybe we can focus on Will's relationship with Skylar.
Sure.
Right. So I think that when Will comes back and says like, "Oh, you're probably going to tell me that I broke up with Skylar because of my attachment issues," and Sean's like, "I didn't know that. You broke up with her? Why'd you do that?" And they are talking about learn that she's not perfect. And of course, Sean, maybe with almost too much clarity, is like, "Are you sure that it's not you're worried she's going to see you're not perfect?" But I think that the thing that was more therapeutic there is like, well, the avoidance strategy is not a strategy. You are never going to know if this is worth pursuing. And yeah, there's risk in being vulnerable, right? And you can't say nothing bad will happen. A bad therapist would say, "Oh, nothing bad is going to happen." They're going to say, "I can't promise nothing bad is going to happen here. But if you are going to see this through, you need to make some choices and make those decisions yourself." So I think motivating Will to see sort of the weaknesses in his approach, to see like how it's not helping him, to see how taking a risk could be associated with something positive, whether that's leaving Boston, pursuing Skylar, taking a job if he were to go Jerry's way. I think that all of those things, he just is like, well, nothing bad is going to happen if I just don't act on those things. Everything will stay the same.
Yeah.
And so I think that
good old
Sean
status
is
quo
trying
bias
to help him through seeing how growth might be painful, but also positive.
I agree with that. So those are some behavior change suggestions.
Right.
What about the cognitive side? What does CBT attempt to do on the cognitive side, and what do you see in the movie?
The assuming blame and seeing himself as a negative person, or even the motivation in a less serious way, the motivation for why he wanted to be a janitor at MIT, like that maybe he is wanting more. And so like, what is it that you would like? Trying to get him to reflect on and think about what he wants out of his life.
Yeah.
And he had never really wanted to confront that before. And so I think getting him to open up about what his desires are, about what his wants are, those kinds of things. But again, the big one is how it's not his fault that these terrible things happen to him. And he he intellectually knows that. That's how he knows everything, is intellectually he knows it's not his fault, but he still internalizes all of that. And so unpacking that.
Yeah. So would you say that Sean's job here would be to challenge and suggest alternatives to his current thought processes?
Yeah, I think so. I think that he is really going to challenge him and say like, okay, you're comfortable in Southie. You know everything in Southie.
Right.
But the motivational interviewing approach, for example, is about trying to get, not to say like, I want you to be motivated to do this. It's how can you get that client to be motivated to want to do this? So let's say that you're trying to get a person to stop procrastinating. You're trying to get a student to stop procrastinating. And they're like, okay, yeah, I want to stop procrastinating. And you say, in what ways would your life be easier if you stopped procrastinating? Or what are some of the things that you do that you recognize, and trying to get them to recognize instead of just listing out for them. Like all the things that they're doing. Because we can do that, but that's not going to resonate as if they come up with it on their own.
Very true. One that I spotted, which is part of this whole process of challenging or suggesting alternatives to thought processes, was going back to the Sean telling Will about how he met his wife. And as you said, Will has this big old Southie bias with blinkers on. right? He never imagines anything other than Southie, right? And so he has this preconception of what it means to date and court and look for a partner and be with women, or somebody that you find attractive, etc., right? And so as Sean is telling him this story, the only thing that Will is focused on is the fact that he missed game 6 of this baseball game. And it was funny to me watching it again that I was more enraptured. I said it in the intro that I saw this movie when it came out, and I was about 11 or 12. So not a movie for 11 or 12.
Are you saying you were not the target audience for this
I was
film?
not the target audience. Anyways, any rewatches since that first time didn't really hit as hard as this one when I came back to it, because I found myself far more enraptured by the story of Sean getting the date with his future wife, and finally saw why they wrote Will to be so incredulous there, because Southie was all about the Red Sox.
Oh yeah.
And I'm sorry, darling, but the game is on. Yeah. We're going to have to see about each other another time. And he didn't realize that you could do anything else.
I think that it shows, and not just a Southie thing, a little bit of just youth, of realizing what's important, what seems important in the moment. That's not just a youth thing. It's a trap that people can fall into. And then sometimes it takes something jarring to shake you out of that, like a health crisis or something. And then you realize what's important, right?
Yeah.
And Sean knew what was important in that moment for him. His buddies didn't. His buddy said, "You're making a mistake. You're not going to go with us. I can't believe you're not going to go with this over some girl." Because most girls are just some girl, but this wasn't just some girl. And so he wanted to see if she was the one, and he regretted none of the time that they spent together. And it's a beautiful story. But it's also the kind of thing where, people talk about FOMO and fear of missing out. And, you missed Pudge's home run, all these things. But he was concerned about missing out on something much more important. He was playing the long game.
Yes, long game rather than the short game. Absolutely. So that is, I think, a good encapsulation of the therapy that's portrayed in the movie. Of course, we could flip it on its head and say that Will was also doing some sneaky therapy on Sean, but we, of course,
hopefully Sean gets a little therapy during his travels.
That's true. He should keep up with his own. He needs
a little help too.
He should keep up with his own stuff. Yeah, he needs to process that grief, man. Anyways, we're going to take a quick break and come back with Dr. Ed Hansen talking Good Will Hunting. Are you a big fan of the Cinema Psych podcast? A connoisseur of the compelling stories and intriguing insights that we have on this show? Well, show your love in style with our premium podcast merchandise. Yeah, that's right. I've updated the podcast store from ultra comfy hoodies, perfect for cozy podcast binges, to sleek coffee mugs that add a dash of personality to your morning routine. Our merchandise store has it all. I've added so many new products, and it's designed to withstand countless listening marathons. There are a lot of episodes. I think you'll love them. But wait, there is more. Every week, there is a new promotion, turning up the volume on value. So keep an eye out for our exciting special promotions. Every other week, 15% off. In between, sometimes there's a special 25% off day. And then sometimes there's free shipping. It's the perfect way to score your Cinema Psych podcast merch for less. I'm excited to have expanded the merchandise offerings, but I'm really excited to say that new designs are coming up. And you can put these designs on all of the merchandise. So keep an eye out for new arrivals in the design section. So don't just listen, wear it, flaunt it, live it. Visit our merchandise store at cinemapsychpod.swanpsych.com/store to shop your love for the Cinema Psych podcast today. Remember, every purchase goes directly to supporting this show. And of course, thanks for listening to this show. I love doing it. Now let's get back into it. And we are back with Dr. Ed Hansen talking Good Will Hunting, 1997's best original screenplay, Oscar winner, of course, that Matt Damon and Ben Affleck vehicle to stardom. Unfortunately, it was with Miramax, so what are you going to do? Rough times. Anyways, Ed, I'm going to call this next section the grab bag social psychology and development. That's what this segment's going to be all about, because there are...
That's good, because I teach social psychology and development.
Yes! It's like we saw this coming. Anyways, I'll call this the grab bag because there were a lot of topics and concepts that we find in these classes like these, that we can tell the fine listeners of this program. So I'll let you start. What was your big socio-developmental concept?
I always love thinking about character growth. Mm-hmm. Right? I always love thinking about where does the character start? Where does the character end up? Mm-hmm. And for me, even though, like, whenever I have to talk about psychoanalysis in any way, my students are always quite aware of how I feel about that, and it ain't good. But I can't help always talking about Erik Erikson and his psychosocial development. Like, he was one of the things that he was really, really impactful for was that he was one of the first people to say, hey, development doesn't stop when you're 18.
Yeah.
Development continues
right
through life. It's not like you turn 40 and you're like, I'm done now. You turn 25 and I'm done now. It keeps going in different, new, unexpected ways. And so, sure, he overstates that everything is a crisis. I'm not so concerned about people understanding and memorizing every psychosocial crisis in Erikson's 8 stages of development. But there's so much evidence that people really do struggle with finding that sense of a strong identity that I talk about that in my class a lot. And so I really am always interested, to the point where it's one of the places where I use film the most, is I will try and get my students to, whether it's for credit or extra credit, depends on the class, come up with characters from movies or books or TV shows that they like, that are going to show sort of these different statuses of identity achievement. And even though Erikson only said, like, okay, it's either achievement or confusion, there's no in between, it's only achievement or confusion, there was James Marcia added on to this with this idea of it's all about how committed you are to this sense of identity and how much exploration you have actually done.
Okay, that's a new one for me.
And so it's sort of this little 4x4 framework, 2x2 framework, rather.
Sure.
Where if you're high in exploration and high in commitment, identity achieved. Congratulations. Strong identity achievement. If you are low in commitment and low in exploration, which is where Matt is kind of through a lot of this film, he's just like, yeah, I'm drinking with my buddies. Hakuna Matata is the example. I always talk about Timon and Pumbaa from The Lion King. They're just walking around, looking around, having a good time. Hakuna Matata means no worries for the rest of their days. And that's kind of where Will is at.
Yeah.
That he's just like, hey, life is good. I like hanging out with my friends. And so he's not worried about who he is or who he's supposed to be someday. Sometimes people commit to an identity too early. And this is that sense of strong identity achievement, even though you don't really know what's out there. And he has a little bit of this as well. He's like, yeah, I picture myself growing up, going to work with you all. Our kids are going to play games together, baseball games together. And we're just going to, I'm going to live here. I'm always going to be in Southie. And it's sort of committing to I'm always going to be in Southie without ever getting out of Southie. And so it's like when a person says they're going to be a doctor because everyone in their family is a doctor, or going to be a lawyer because everyone in their family is a lawyer.
Mm-hmm.
And of course, identity is not just occupation. It's not just sexual identity. It's all these things.
Yeah.
But, he's not necessarily thought about any of them except for the fact that he identifies with being in Southie. Then the flip side of that is kind of your stereotypical college student with an undeclared major, that it's all exploration, no commitment, right? And that's called identity moratorium. And so identity moratorium is like my students that were studying abroad. I joked with them, this is a very normal way to explore your identity, is to study abroad, travel, get out, see places around the world, or even just take elective courses that aren't for your major, which is an important part of discovering what's out there. I didn't go to college knowing I was going to be a psychology professor, but I took an elective as a sophomore as a psych class, changed majors, and so many of us changed majors along the way. That's just part of the path, right?
Yep.
And so thinking about him and where he's at, he's always been scared of getting out of that comfort zone.
Mm-hmm.
He has not wanted to see what else is out there because what else is out there could hurt him, or could be embarrassing, or could be a negative experience. And so he has been in this sort of identity diffusion where who cares is his approach, but a little bit of just also the resignation of like, well, this is my life. This is where I was born. This is who I'm going to be. That's identity foreclosure as well. So I always enjoy those kinds of topics. So I would probably lean into that topic in a classroom.
Excellent. I like that one. I learned something new with the Marcia stuff, and I honestly avoid most developmental stuff in my classes, so Erickson doesn't come off my lips very often.
Thanks. That's good. So how's your lady? She's gone. Gone where? Medical school in California. Really? Yeah. When was this? It's like a week ago. Well, that sucks. So, when are you done with those meetings? Like the week after I'm 21. Yeah, they gonna hook you up with a job or what? Yeah, sit in a room and do long division for the next 50 years. Yeah, probably make some nice bank, though. I'm gonna be a lab rat. Better than way out of here. I want to way out of here for. I mean, I'm gonna live here the rest of my life. Be neighbors, we'll have little kids, take them to Little League together up Foley Field. Look, you're my best friend, so don't take this the wrong way. But in 20 years, if you're still living here, coming over my house to watch the Patriots game, still working construction, I'll kill you. That's not a threat. What? That's a fact. I'll kill you. What are you talking about? Look, you got something none of us have. Oh, come on. Why is it always this? I mean, I owe it to myself to do this or that. What if I don't want to? No, you. You don't owe it to yourself. You owe it to me. Because tomorrow I'm gonna wake up and I'll be 50. And I'll still be doing and that's all right, that's fine. I mean, you're sitting on a winning lottery ticket. You're too much of a pussy to cash it in. And that's bull. Because I'd do anything to have what you got. So would any of these guys. It'd be an insult to us if you're still here in 20 years. Hanging around here is a waste of your time. You don't know that. I don't? No, you don't know that. Oh, I don't know that. Let me tell you what I do know. Every day I come by your house and I pick you up. And we go out, we have a few drinks and a few laughs, and it's great. You know what the best part of my day is? For about 10 seconds from when I pull up to the curb and when I get to your door. Because I think maybe I'll get up there and I'll knock on the door and you won't be there. No goodbye, no see you later, no nothing. You just left. I don't know much, but I know that.
My top social developmental concept is a topic that is mentioned in the movie through the dialogue. So that's attachment theory. Mary Ainsworth and previously Bowlby and other folks argued that when children are young and developing, even as early as infants, develop these different kinds of attachment styles. And style here is a catch-all term, like syndrome is where it's a collection of symptoms. Style here would be a collection of behaviors and most likely cognitions, but of course we can't really tell what a baby's thinking because they can't answer us. So I believe Ainsworth came up with 3 attachments, or if it was Bowlby.
He added a 4th one later, but it was like that catch-all disorganized category, right? But you're correct. And part of the reason why I didn't bring that up is I knew you were going to. It's the greatest hits of development, right?
You're right.
So most people are fortunate to have a version of secure attachment where they are securely connected to those parents and or whatever attachment figures it might be. And that it's going to correlate with positive outcomes throughout life, and toddlerhood and middle childhood and early adulthood and so on.
Yeah. This was like the main piece of Ainsworth's theory is that the kind of attachment style. So it wasn't just identifying the attachment styles and ending their discovery there and let other people do it. No, they wanted to use these styles to see what happened to children after they grew up with these styles. So you label someone with a style and then you track their trajectory, or you do other methodology.
And it's also kind of really nice, great early example of cross-cultural application of psychology too, that you see the attachment styles are replicated cross-culturally, whether it's Africa, West Europe, Australia, all these places. You see these really similar infant attachment styles. And then, a lot of people extended her work into adult attachment, of course.
Yep.
But yeah, it's seminal research for a reason, for sure.
So Will is said to have, and maybe not in so many words, but is suggested to have several behavioral patterns and observed thinking. Well, maybe not observed thinking. Behavioral. Well, I'll just say behavioral patterns. Behavioral patterns associated with an avoidant attachment. So these are going to stem from his traumatic childhood experiences as a very young child, because these events do end up shaping the children. And we have several decades of research, and I'm not even suggesting what Freud had stolen from his collaborators. That we've known about this for a long time, that childhood experiences do shape, and negative experiences, which are labeled as trauma, are going to have a negative impact. And in this case, his avoidant attachment might have led to certain behavioral choices and a certain way of thinking, which then perpetuate the pushing away of people, that kind of thing.
There's the distinctions of, like, if you have a more negative view of yourself, a more negative view of others, a more positive view of yourself, a positive view of others. I don't think he feels very good about any of it, right? And so he, at times, is anxious, is at times avoidant. And so I think that when he is saying, like, well, Skylar's perfect, I don't want to mess this up, that's more of an avoidant approach. I agree. But also I think that with his history, it's not like he views other people as, like, perfect. He sort of assumes everyone's going to be the worst. Yeah. And he has gone through so much trauma. And it reminded me of how when children go through severe abuse when they are young, that they're likely to develop signs of what's called oppositional defiant disorder, right? And so it's that no matter how loving, even if he had a foster family that was loving, that was trying to give him everything he needed, he wasn't going to trust that. He wasn't going to accept it.
Mm-mm.
He wasn't going to be open to that. And so much damage had been done that, by that point, that having a healthy bond with other people, unless it was drinking buddies,
right,
was sort of out of the question.
And you mentioned that, a kid might be diagnosed with ODD, oppositional defiant disorder. In the movie, they do say that Will has an attachment disorder, and they kind of trail off there. So obviously leaving it very vague and ambiguous as to what they were meaning. And I believe once a child grows into adulthood and still expresses this severe clinical defiance, it's called conduct disorder in the DSM. So,
well, would that be consistent with his like picking fights and all those kinds of things?
Oh, absolutely. The shirking of authority or shirking of responsibilities and thumbing one's nose up at authority and lots of other things, right? Not the least bit remorseful getting arrested for beating the guys up. And we barely see the reason why they're getting beat up. It's just the instigating incident, and they're like, yeah, the yada yada over quite a bit of it. There's a lot of Boston slang going on in that early set of minutes.
You mean you don't hold grudges over things that happened to you in kindergarten that you had just started a brawl over?
No, I don't think so. I don't think so, Ed. I don't think I do that. Nope. And before we jump to the next one in the grab bag, I do want to say that this was the first time that I recognized, as far as like attachment theory goes, and Sean building a relationship with Will. And as you said earlier, this is probably not good, but he sort of becomes a father figure. And of course, you don't want that. You're a court-mandated therapist. Leave it at client therapist. Leave it at the client therapist line and no further. Must go no further, right? But he does start becoming this pseudo father figure to Will at the end, because even his language shifts in sort of the slang of the time, right? An older man to a younger man, to strangers, it's chief. It's like, hey, chief, slow your roll. It's all right, chief. Like when you want to identify someone in your orbit and you want to kind of speak down to them, like it's very condescending nickname to give to someone, especially an older man to a younger man. Like, hey, chief, back off, right? You're not as high and tough as you think you are, right? And then he shifts to sport. Starts calling him sport, which is I want to say, even at that time, was probably a little tongue-in-cheek for how the nickname for a son is sort of like, at least heard by me. Like it always sounds kind of forced, especially in TV shows where they kind of like shoehorned it in, like, hey, sport, what are you up to? Kind of goofy, but clear boundary shifting, right? Sport is more open, regardless of how goofy it sounds. It's more open and inviting, and a closer connection there. And then at the end of the movie, the last several scenes that they are together, calls him son. And I lost it when I realized that at the end of the movie. I was just like, I am sobbing, and this is beautiful.
This movie is too beautiful, man. It's especially the second half of the movie. As I was rewatching it, I was kind of thinking to myself, is this movie as good as I remember it is? And then the second half of the movie, it all brings it home.
Yeah.
No, I agree, because professional boundaries aside, he needed a healthy relationship in his life.
Yeah.
And this is starting to look, but it's not permanent also. And so it sort of showed him like, hey, I can trust. And it, like you say, Chekhov's gun, it's back. And so he can trust him again.
Yeah.
And so now when they've got a relationship where they're both being open with each other, so they got to that point. I don't know, to me, calling him son almost felt more forced than calling him sport. That gave me more pause in that moment, because I've never called a student son, no matter how much I like them, right? And so,
well, just wait, 20 more years.
when I'm older, and that's true.
When you're 20 years older, but your students are the same age.
Fair enough. It's
right?
Already happening.
And you're gonna,
degree,
excuse me, son, do you belong here?
Yeah, I could totally say Sonny, but no.
So for this grab bag, one more social psych concept you want to lob at the listeners.
I think that park bench scene, let's go back to the park bench, right? When they go on their little field trip, which we agree doesn't happen very often in therapy, but, what is he trying to get across to Will in this moment? And I think it's like, man, you have read all these books. You can tell me all these things, but you haven't lived at all. You haven't lived any of it. And there's this term, phenomenology, which is sort of the anti-Freudian unconscious approach, right? It's all about the importance of your conscious lived experience. It's about the importance of what has actually happened to you and how does that shape your worldview, right? Because what's happened to us shapes our worldview. It shapes our construals, everything. When I'm teaching it in a classroom, I use the example of whether or not they think Tallahassee is a small town. Because my students from Miami, Jacksonville, Tampa, Orlando thinks it is the middle of nowhere. It is a small town.
Super dinky with a state capital.
And I'm like, y'all have never seen a small town. Like, I grew up between small towns. Like, Tallahassee's by far the biggest place I ever grew up, or biggest place I ever lived. And so, like, our lived experiences, I always joke with them. I was like, Tallahassee has 3 Targets. What do you want in a city?
Right.
And it's just
that's all you
really
need.
And so it's about the lived experience shaping what happens. Like when I took my students to a play in London, it had this really saddest thing I've ever seen on stage. And there was a scene where this relationship gets back together. And some of my students were like, I'm so glad they found true happiness. And that's not how a lot of students interpreted it. It's just like, oh no, this is a bad choice. This is a bad decision. They got back together in January of 2020. Like, we knew that, we know what's going to happen. It's not good. And yet some of the students saw, like, I'm so happy that she's happy now.
Uh-huh.
And it would be the equivalent of seeing what Will Hunting going out to California. And it's like, his life is going to be so much better. And it's like, this is just the beginning of a lot of experiences.
Yeah.
And you don't know if they're going to be good or bad. And so phenomenology.
Or if he'll be happy or sad or mad.
It's about how we can look at the same thing and interpret it with such different perspective based on what's happened to us. It's like you and I watching this movie are going to be drawn to different things because of our different lived experiences.
Very true.
And so when when Swan says, you ripped my heart out and then I realized something and then I fell into a deep sleep and I haven't thought about you again. And he says, you're just a kid. You haven't the faintest idea what you're talking about, which is harsh. But then he talks about how he's never gotten out of that city. He's never gone to these museums. He's never had these experiences. And it's funny how, like, when he finally breaks his silence with the good CBT of letting Will being the first to speak, Will's like, I've slept with a lady before. I have had sex.
Yeah,
that's what he felt like he had.
That's
to
what
say
he had to do. Yeah,
to
we
put
could have
out
spent
there.
a whole segment on toxic masculinity, but
right. And so, but no, he says, you've never felt vulnerable. You've never shared yourself in a way that was dangerous and that they were there for you and you were there for them. And I love the phrase picadillos, right? Of like, all those little things about each other. And that's the good stuff.
I have been laid,
Really? Good
Big
for
time.
you.
Big time.
Big time, huh?
I went on a date last week.
How'd it go?
It was good.
You going out again?
I don't know.
Why not?
I haven't called her.
Christ, you're an amateur.
I know what I'm doing.
Yeah.
Yeah. Don't worry about me. I know what I'm doing. Yeah, but this girl's like, beautiful. She's smart. She's fun. It's different from most of the girls I've been with.
So call her up, Romeo.
Why? So I can realize she's not that smart, that she's boring. This girl's like perfect right now. I don't want to ruin that.
Maybe you're perfect right now. Maybe you don't want to ruin that. But I think that's a super philosophy, Will. That way you can go through your entire life without ever having to really know anybody. My wife used to fart when she was nervous. She had all sorts of wonderful little idiosyncrasies. She used to fart in her sleep. I'm sorry I shared that with you. One night it was so loud it woke the dog up. She woke up and got like, "Oh, was that you?" I said, "Yeah, I didn't have the heart to tell her." Oh, God.
She woke herself up.
Oh, Christ. But Will, she's been dead 2 years, and that's the shit, remember? It's wonderful stuff, you know? Little things like that. Yeah, but those are the things I miss the most. The little idiosyncrasies that only I knew about. That's what made her my wife. Boy, and she had the goods on me, too. She knew all my little peccadillos. People call these things imperfections, but they're not. Oh, that's the good stuff. And then we get to choose who we let into our weird little worlds. You're not perfect, sport. And let me save you the suspense. This girl you met, she isn't perfect either. But the question is whether or not you're perfect for each other. That's the whole deal. That's what intimacy is all about. Now, you can know everything in the world, sport, but the only way you're finding out that one is by giving it a shot. You certainly won't learn from an old like me. Even if I did know, I wouldn't tell a pissant like you.
Why not? You told me every other thing. Jesus Christ. Talk more than any shrink I ever seen in my life.
I teach shit. I didn't say I know how to do it.
Yeah. You ever think about getting remarried?
My wife's dead.
Hence the word remarried.
She's dead.
Yeah. Well, I think that's a super philosophy, Sean. I mean, that way you could actually go through the rest of your life without ever really knowing anybody.
Time's up.
Right, that's one of my other favorite quotable moments from this movie. It's like, it's not your fault, and that's the good stuff. Those are ones that I'll just pull to mind because those little imperfections, those little things, unless you have experienced it, like you and I are both parents, unless you've experienced parenthood, you don't know that's the good stuff. But when you look back, that's the stuff you're going to miss, right?
Mm-hmm.
And so that's the good stuff. And I think that scene, I was thinking about what is the most important psychological component of this scene. And it's about perspective taking.
Sure.
Like, my experience is different from your experience. I don't know what it's like to be an orphan because I read Oliver Twist. I can't know what you've been through, but I can try and take your perspective and meet you there.
Right.
And, you know, this is something that I struggle with, and I'm guessing you do too. It's like sometimes in class we talk about these really complex, nuanced things, and we are straight, cisgender, white dudes talking about these things that affect our students in so many different ways. And we can't know their experience, but we can try to appreciate and try to understand where they're coming from.
Yep.
And I think that's in many ways what that scene is about to me. It's about, like, I can't understand your life, but I'm going to try to. We are both from Southie, but that doesn't mean I know who you are.
Right.
It's this surface level similarity, but your lived experiences, my lived experiences, it's all about how you look at things. And so I would probably go into that. But there's no shortage of other good stuff.
I also put an advanced Fourier system on the main hallway chalkboard. And I'm hoping that one of you might prove it by the end of the semester. And the person to do so will not only be in my good graces, but also go on to fame and fortune by having their accomplishment recorded and their name printed in the auspicious MIT Tech. Former winners include Nobel laureates, Fields Medal winners, renowned astrophysicists, and lowly MIT professors. Well, that's all. If you have any questions, I'm sure that Tom has the answers.
Okay, so before we end this episode, this movie has some academia portrayals in it, and so I would be remiss, myself, I don't know about you, but I would be remiss not to mention the things that I noticed from being in the academy, as it were, and knowing how things actually work versus how filmmakers think they work. So the first thing is, we barely talked about him all episode, but Jerry is our punching bag in this persnickety segment. I should start calling it the persnickety segment.
Yep.
So Jerry is a lauded winner of the Field Prize or the Field Medal for amazing mathematics. I think combinatorial mathematics. I don't even know what that is. At the prestigious Boston University of the Massachusetts Institute of Technology, MIT. And that apparently affords him not only free reign over the damn campus, but a minion. I snuck this in a little while ago. I don't know if you heard me say it, Ed, but you were describing Tim. I think you were saying his little graduate assistant, and I just said minion because he's the weirdest character in this whole movie, and I am convinced that Matt, Ben, and Gus Van Sant had no idea how a faculty member, even of Jerry's stature, fictional stature, how they wouldn't have, like, a graduate assistant doesn't mean like an actual assistant. I thought that was hilarious. Like, yes. Even the violations of health privacy laws and laws associated with confidentiality in the justice system, and this guy Tim's going to his Will's therapy sessions and sitting in them until he's like, oh no, we're getting finally getting kicked out of this one, and he just rolls his eyes when Will doesn't do the right thing in at least the first two that we see. And it's just like this negative Nancy the entire movie. So it was a weird situation. I
will say I felt a little bad for him. I felt a little bad for him because
even if he was being paid, sure.
The discovery of Will Hunting, he probably thought that he was the protege. He was the eye of Jerry's eye, the apple of Jerry's eye.
Fair enough.
He thought that he was going to. So I think that he's a third wheel. He's lingering where he's not needed or wanted.
With emphasis on wanted, apparently, yes. At least from Jerry's perspective,
he is like desperately trying to make himself relevant where he no longer feels relevant. I think that he is, at the beginning, Jerry is like, if you have a question, I'm sure he can answer it, right?
Yeah, that's true.
And so he thought very highly of him until he looked like a real dum-dum next to Will.
If you have any questions, I'm sure Tim could answer them.
I think that in a rather clumsy way. That was a good impression of him, by the way. I think in a rather clumsy that to be like this sort of, the losing end of an academic rivalry. I think that they wanted him to say like, oh, I lost out. I used to be the scholar with a lot of promise, and all of a sudden just totally irrelevant.
Yeah, he even mentions it to the other renowned combinatorial mathematician who is aghast when Will just like, oh, here you go. Here's the solution. I wrote it down for you so you guys could follow. And he's just like, the professor walks out, just like all of my life's work completely shot. And I'm thinking to myself, they really gave Will Hunting a superpower because there's absolutely no way that Will Hunting is that smart just from reading books and solving these problems that have made old men. If you catch my meaning on this one, these men have been working on these problems for so long that
maybe
they're old
he just doesn't want to sit around explaining people, Alex.
That's very true. Yes, there is for many researchers, They don't like putting up with teaching, but then of course there's us who just spend our days telling people about things.
It's funny because like there are definitely people who would just, rather be doing anything else. They'd rather be working on their next experiment. They'd rather be doing anything like that. And maybe Will could have gotten there with a different path. But man, the devastating blows to these guys' egos that he delivers just like with no effort at all.
Yeah. And
it's a fantasy in that respect. But it's
on the flip side of this professorial relationship, we've got Jerry on one end, which we can even go even further down that rabbit hole.
He's gross.
He is very gross. We have Sean, right? And Sean is shown again, Chekhov's lecture, shown teaching at a community college. Like they have the name emblazoned. I think it was a made up community college for the movie, but he's teaching at this community college, which is apparently nearby, still in Boston. It's like Boston Community College is maybe what it's called. I don't know.
Something along those lines. Yeah. But I think I agree that it's a fictional one.
And so he's teaching, he's supposedly teaching something where he's going to, be a client-centered therapist, or at least somebody with this background, because we learned that he was a VA therapist for a long time after being a veteran himself. He's teaching this class and he's teaching about trust. And of course, my mind immediately went to, wait a minute. There aren't going to be therapy related or counseling related classes at a community college. These are upper division classes in psych curricula. They're not lower division classes, and community colleges only teach lower division courses.
Okay, so even if you gave him the benefit of the doubt and he's like teaching a history and systems class,
I can't give him the benefit of the doubt.
So I'm going to say, because when I teach developmental, I'm a social person, so I'm teaching it in a social way.
Yeah.
So when he's teaching history and systems, he's a counselor. He's teaching it from
history and systems way. History and systems, where I'm from, Ed, is an upper division class.
Oh, well, it may be different in different places, but yeah, maybe it's remedial history and systems.
Yeah.
It's,
yeah. A freshman's going to take history and systems. Oh my God. They would die. They would die. What are all these words? Sir,
but I mean,
sir, what are all these terms?
They have to take art history and stuff too, though. It's not so different. But no, I think that it's a stretch. They shoehorned him into a community college so that Jerry could, sort of throw his success around.
Yeah, his status. Yeah. Was, I honestly think the movie could have done without the over-the-top butting heads between Jerry and Sean.
Yeah, it was so hot and cold, so intense.
It was tiresome by the end. You're like, okay, yeah, all right. You guys don't like each other in many ways, so and like you hurt
because some of the things
you hurt my feelings. I hurt your feelings. We're hurting each other's feelings. There was a lot of that for sure. The last,
I do agree about what you're saying about Sean's classroom not really fitting, but I would just watch Robin Williams lecture on anything, so I let it go.
Yes. And of course, he gets interrupted. If it were my class, I'd be like, you can wait.
Yeah.
Right? He just seems to let the other... he just seems to end class at that time because apparently seeing his old friend / roommate...
Well, yeah, the way that he says we're in the presence of greatness, I suppose does show how deep that wound goes.
Right.
It's like, this person is talking to me and it's just like, yeah, we're done.
I also found it funny just in this scene in particular that Robin Williams tosses an apple back to one of his students. Like, seriously? I want to know whose idea that was. And I want to know if they were born in the 1950s.
Well, I am going to go out on a limb and guess that was Robin Williams' idea because he riffed a lot in this movie.
Sure. Okay. Then that may have make sense to him. Like, oh, teachers So this would be his misunderstanding of teachers then. Teachers love apples. But a college professor is going to be like, why is a student giving me an apple? That's not good. Ha 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 ha. And we'll all go, hey. Yes, the movie was released in 1997. There were different sensibilities about what was closer. Because remember, Ed, just to make you feel a little bit older, the 90s were 30 years ago. 1994 was 30 years ago, which means the movie itself is what, 27 years old? Yeah. And so 27 years before 1997 was 1970.
Yeah. You know, the fact that they tried to make that 90s show work on Netflix is the same kind of time difference we're talking about. You know, it's just like, seems like it was just a couple years ago was a couple years ago. It was a lot more than that. But that's not our students' problem. That's our problem.
Yeah, that's true. So the last one that I wanted to point out before we end was the narrative that you see blue collar versus white collar jobs, and Matt and Ben being from Boston, having a soft spot for all the white working class folks there. They wanted to pay homage, the construction workers, the roles that you see pretty much everyone play in the movie that is from Southie, right? But also Will being custodian, the other guys at the facilities, right? They're shown in a positive way, whereas the white collar workers in the movie, notably the two professors, one just a really smart guy at MIT, and then just a down-to-earth veteran at community college, salt of the earth, but still kind of like the enemy in a way, because, we get the early choke scene. Of course, Jerry is a hoity-toity. And so the white-collar workers are shown as out of touch, and that the townies themselves are better than these so-called elites, which takes us all the way back to the most famous line of this movie, which we have not mentioned at all.
We never talked about the scene in the bar.
We have not mentioned at all. And the listener heard at the very beginning of this episode, how do you like dem apples? And I said it purposefully that way because it really accentuates the oddity of this phrase, and yet the power that it brought. And like everyone going, yeah, screw you.
Hey man, the first time I ever saw that part resonated with me harder than anything else. I was like, if I was his buddy, I'd be so proud of him in that moment.
Yeah, absolutely. And then of course, not to belabor the point in between for these two, Clark and the guy's name is Clark and Will, right? About the Clark trying to one up this stupid townie, this stupid guy from Southie, because they were at a Harvard bar, and then Will just like shows him up 100%. Solid scene.
Yeah.
I love the deconstruction of Clark by Will Hunting. It was solid. It was very good.
Oh yeah. But I mean, when you talk about the classism, and when you talk about how like Sean was able to connect to Will because they had the same background, it's like, well, that's a bit of a trope too. Because I mean, obviously, counselors are asked to connect with people that don't have their same background. They
absolutely,
just have to be sensitive to it. But I'm gonna push back a little bit because I think Skylar disrupts that narrative. I think the Skylar character is such a strong character, and that she was born with privilege, and she recognizes that, but she also doesn't put herself above anybody else. And I think that she is. There's the scene where she said she was give it all away just for more time with her family. So her lived experiences, going back to phenomenology, she knows what's important in a way that he is learning. And so I think that she's like, yeah, I'm studying to be a doctor. I'm proud to be studying to be a doctor, but that doesn't mean I'm going to treat you like you're anything less. I don't care about what job you have. I don't care about all those things. And he sees her a bit of as a caricature, and she eventually is more of a human that he loves potentially. But yeah, she's such an interesting character. I love the Minnie Driver character. I wish that I would see Minnie in more things after rewatching that movie.
Mm-hmm.
But no, I think that her character, maybe it's a little bit tropey too, that she's just like the only one that's different. And so I struggle with it.
That's why I will concede your point about her characterization, but I still hold that there's this blue collar versus white collar worker.
Oh yeah, well, especially in a town like Boston that's so known for its universities.
Yeah, right.
There does have to be like different perspectives on like, oh yeah, the Harvard bar. I thought you'd have like equations on the walls.
Yeah,
that it's just like, no, they're just people going to a bar, and it gets at these. Whenever you talk about cross-cultural differences, for example, again, my London students is an example fresh in my mind. We always talk about how there's more differences within groups than between them, but we spend more time talking about the differences between the groups. And they're not different kinds of people. The truth is that blue collar, white collar, they all have jerks and they all have great people. And, that they just haven't met a lot of, Will hasn't met a lot of people, even though he loves his buddies and he would die for his buddies. But the people he grew up with were terrible. And so it's like, it's not all of the white collar people are bad, but not all the white collar cared about him and his struggles. And I think that part they showed. But way of almost showing like he was going to feel guilty if he was successful or left his buddies behind. But we didn't talk about this, how much his friend, what's his name, Chucky, the Ben Affleck character, really wants him to take those risks and to not be forced to choose the choices that Chucky is doing.
Yeah, I agree. There are quite a few more things about academia and adjacent that we could talk about, but boy, this is a chalk movie, right, Ed?
Oh yeah. I mean, there is so much we did not talk about that we definitely could have just continued to expound on. The fact that we didn't talk about the apples or Skylar until just now, I think, exemplifies that.
Yeah.
But yeah, I'm glad that we talked about this movie because there are, no matter what you teach, I think there are things that you could pick from here that are going to illustrate all kinds of stuff that our students might care about.
I want to thank Dr. Ed Hansen for joining me to discuss Good Will Hunting. Before we say goodbye, Ed, is there anything that you'd like to share with the listeners? Where can folks find you?
Well, I mean, you can find me, just on social media. I don't have anything to plug or anything like that. I've connected to so many great educators and co-hosts that you've collaborated with through this show and things like this through Facebook and Twitter, X, Excellent. All those different kinds of things. So if people want to look me up, Ed Hansen _PhDad on Twitter/X. But otherwise, no, I'm just FSU. If you want to find me in Tallahassee, you can try. But nothing to plug.
Well, that is excellent, Ed, and I will link your handle for the folks to find you. Thanks again for joining me, Ed.
Oh, thanks for having me. It's always a pleasure. Now my wife has been patiently waiting, so I got to go see about it.
And that's going to do it for this episode. Until the next one, thanks for listening.